All right, so good day, everyone. Welcome to Mpox in Focus, a webinar on an evolving global health emergency. This webinar is brought to you by the Ateneo de Manila University School of Medicine and Public Health in partnership with the University Health Services. I am Dr. Jello Apostol, Assistant Professor and Head of the Environmental Health Program at ASMPH. And we're gathered today at a pivotal moment in public health, both globally and here in the Philippines. As of today, the World Health Organization has reported over 80,000 cases of Mpox across 110 countries. This unprecedented spread has prompted the WHO to declare Mpox a public health emergency of international concern. Here in the Philippines, we've recently confirmed our 10th case of Mpox, specifically Clade 2, which experts believe may indicate sustained local transmission. As we begin our webinar today, we invite Dr. Ray Bakiran, ASMPH Associate Dean, to lead us into prayer.
We enter a moment of silence to remember that our God is always with us, above us, beside us, and within us. We gather here today, O Lord, to inform ourselves about a new threat to the public's health and to the health of every Filipino. We ask for the grace of wisdom and understanding that as health professionals and as individuals responsible for our own health, we can be knowledgeable of the dynamics of this disease. Allow us to be many steps ahead so that as individuals and as a community, we can protect ourselves and help protect others from its effects. Allow us also to participate in your healing mission so that we can extend our expertise and compassion to those who may ask for our help. In the dim years of the recently concluded COVID-19 pandemic, you have shown your great love for us by keeping all of us in the shadow of your embrace. In the midst of all the fears and the uncertainties, you assured us that you are in command and that we are precious in your eyes. Despite our unworthiness, you did not abandon us. For all of these, we are immensely grateful. In this new challenge that we face, we ask for fortitude. Allow us to discover this grace in the life of your Son and our brother Jesus, who faced his adversities with great courage and full trust in you. Allow us to be strengthened by the experience of the past pandemic, utilizing what helped us as a community and discarding the selfishness that led to divisions. Send forth your Spirit that we may cherish the gifts that come from you and your Son, that we may be generous in giving, serving, toiling, and laboring without seeking rewards. We ask our Blessed Mother to be our intercessor, always pointing us to Jesus, telling us that we do what he says and imitate what he has done. Glory be to the Father, the Son, and the Holy Spirit, as it was in the beginning, is now, and ever shall be, world without end. Amen. In the name of the Father, the Son, and of the Holy Spirit. Amen.
Thank you very much, Dr. Ray, for leading us into prayer. And to officially open our program, we now invite Dr. Sinon Alfonso, Dean of ASMPH, for his introductory remarks.
Thank you, Jello, and good morning to everyone, and welcome to this webinar with Mpox in Focus. Unlike SARS-CoV-2 coronavirus or COVID-19, Mpox, or formerly known as monkeypox, has been known as early as 1958, in fact. But recently, outbreaks have been reported in Africa, and in Europe. So much so that just about 10 days ago, the World Health Organization's Director General, Dr. Tedros Adhanom Ghebreyesus, declared Mpox as a public health emergency of international concern. That's about 10 days ago. With the memory of COVID-19 still reeling fresh in our minds, the world again is alarmed. This is the very reason why concern with the community of the university, the School of Medicine and Public Health of Ateneo launched this webinar. We wish that at the end of this short meeting with everyone who cares, we will be able to allay fears and assuage most of them with science-based practical information about Mpox, and hopefully allow space for us to prepare for whatever eventuality there is, whether we need some interventions like vaccinations or preventive mechanisms that we need to do, or excuse me, certain changes in our daily lives, so that bringing this up into consciousness, we may be able to contain outbreaks. We hope that with this webinar, science-based practical information we can share with everyone in the community, and we will be able to allay public fears amidst this emergency of international concern. Now, I'd like to take this opportunity to personally express and publicly express my gratitude to the ASMPH Center for Research and Innovation, or we call it ACRI. The director herself is Dr. T.P. Tanchanko, who heads the ACRI for organizing, coordinating this with the Office of the Vice President of Higher Education, Dr. Marlo Vilches, and the Vice President for Mission Integration, Dr. Benji Tolosa, as well as with the Assistant Vice President for Health and Wellbeing, Dr. Shaw Marquez, and of course, uploading this to the Blue Board with Misma Tech Villanueva. Thanks very much for this opportunity for helping out the entire community be more conscious and spreading the word, so that we will be able to allay their fears and probably prepare the community for whatever eventuality that will come. With this, we welcome you, and please feel free to cast out your questions or type them out in the chat later. Thank you very much.
Thank you very much, Dean Alfonso. And true enough, while this situation is serious and requires our attention, it is important to approach it with calm and informed action rather than fear. The goal of our webinar today is to equip you with accurate information and practical strategies to protect yourselves and our community. Now, to guide us through this complex and evolving topic, I'm honored to introduce our resource speaker, Dr. Karl Evans Henson, an infectious disease expert and former director of the Medical City Hospital Infection Control and Epidemiology Center. Dr. Henson has been at the forefront of managing emerging infectious diseases and has been actively involved in the Philippines' response to the Mpox outbreak. Dr. Henson, thank you for being here. We look forward to learning about the realities of Mpox, its implications to our community, and most importantly, the concrete steps we can take to mitigate its spread. And to our attendees, as we listen to Dr. Henson, we encourage you to type in your comments in our Q&A portal, and we hope to answer all of them later during our Q&A session. Now, let's all welcome Dr. Karl Evans Henson.
Thank you, Jello, and thank you for the invitation, Dr. Dean Alfonso. I am very pleased and honored to be invited to give this talk. Let me share my screen so that we can start. My understanding is that this is going to be a mixed bag of attendees. Now, this has been opened even for non-doctors, so I will do my best to try and explain things in a way that will be understandable for even the non-physicians among us. So let's start. The title of our talk today is Mpox in Focus, a new global health emergency. I have no disclosures relevant to this talk. And I do have a short outline. I will try and finish within 30 minutes so that we have some time for questions. We will talk about what Mpox is, and then some data about the outbreak, because I think understanding the outbreak gives us a lot of information about what to expect as well. Some slides on treatment and prevention, and then some concluding thoughts. So, what is Mpox? The Mpox is the illness formerly known as monkeypox. It is caused by the monkeypox virus, or MPXV. They have not changed the name of the monkeypox virus, so it's still called monkeypox virus, but the name of the illness or the disease itself has been changed from monkeypox to Mpox. This is a viral infection presenting primarily with generalized skin lesions. And when we say generalized, it's all over the body. And this can be transmitted between people. Mpox or MPXV has two clades or strains. We're very familiar with these terms by now, no? Coming out of COVID. So there's clade 1 and clade 2. Clade 1 is found more is endemic in Central Africa. Clade 2 is endemic in the western part of Africa, Nigeria, etc. Clade 1 has more severe infections. The fatality rate can be anywhere from 3.6, and there are some papers that I saw that go up to 10%. And Clade 2 results in less severe infections. Fatality rate of about 0.2%. I saw some papers that said about 3 to 5%. And it was responsible for the 2022 outbreak from West Africa. And we'll talk about that a little bit later. No? Now let's go to timeline. And this is important for figuring out, infection control, interventions, how long to isolate, etc. There are 3 phases. They are not always distinct. Prodrome, I think, is could be there, could not, pwedeng wala. No? So incubation, prodrome, and the rash phase. The incubation period, and this means from the time of exposure to the first symptom, and patients do not have symptoms during the incubation period. This is usually about a week, no? But the range can be between 5 to 21 days. And that is the reason why when you are identified as a close contact, you are made to isolate for 21 days, because that is the duration of the incubation period. Now, the prodrome phase may or may not be there. It will present or start off as fever, malaise, headache, sore throat, cough, swollen lymph nodes. No? So, very unremarkable or very generic yung symptoms niya. It could be any sort of infectious disease. The swollen lymph nodes can usually be found in the neck, the armpits, and the groin. And whereas in the incubation period, patients are not contagious. In the prodrome phase, they are contagious, or they may be contagious. No? And then if the patient develops prodrome, then after the fever, about 3 days after the fever onset, the rash comes out. What we saw in the 2022 outbreak, the more recent one in 2022, minsan walang prodrome. The rash comes out immediately, and we will talk about the rash a little bit later. No, I have 2 or 3 slides for this. No? So patients may be symptomatic from prodrome to rash from anywhere between 2 to 4 weeks. Okay, so let's talk a little bit more about the rash of Mpox. No? So in medicine, when we talk about rash, it really just is a generic term for any skin lesion. And the rash of Mpox begins as a flat sore or a macule, and you see a picture of that on the right side. When we say it's a macule, when you run your finger over it, there's really no bump. No, it's flat. And then it eventually develops into a blister. Sometimes, or more often than not, that blister is fluid filled. So yung papule that you see on the right, yung stage 2, those are little red bumps without any liquid or fluid. Eventually, it becomes fluid filled. It becomes what's called a vesicle, no? And then the vesicle, and then sometimes the clear fluid of a vesicle becomes pus-like. No, it becomes a pustule. And then that pustule may pop, and then it will result into a scab, no, stage 5. So the rash dries up, crusts over, and then eventually the skin heals or it desquamates. So matatanggal yung scab, mag-heal yung skin underneath. The number of the lesions are varied from 1 to a few hundred or more, no? And it can appear anywhere in the body. Palms of the hands and soles of feet, palms of the hands and soles of feet, face, mouth and throat, groin and genital areas, and the anus. That's why some people, especially what we saw in the 2022 outbreak, some people had a lot of rectal pain, no? Pain with moving their bowels because they had lesions in the perianal area. There were some patients who complained or reported pain on urination because they had genital lesions. No? People are, and this is important, this last point, people are infectious until all the sores or all the rash have healed and a new layer of skin has formed. Okay, so it's similar to the infectivity is similar to chickenpox. Ang chickenpox dapat nag-scab, nag-fall off yung scab before they are cleared to go back to work. No, so a little similarity there. So just to give us a sense of what it looks like in real life. Now this is an early vesicle. So when we say vesicle, the fluid inside is usually clear. Small pustule, meaning there's a little bit of pus inside the fluid, in the blister. And then this is an umbilicated pustule. The umbilication means there's something in the middle, no? This is an ulcerated lesion. This is a scab lesion, yung letter E, crusting of mature lesions. And then the scab eventually starts to fall out. So partially removed scab in letter F. Now, the next slides will show you what it looks like in a Filipino skin. No, this is, I thank Dr. Marja Buensalido for these photos. We took care of, or she took care of someone with Mpox, I believe in 2023, no, last year. So this was one of the 9 cases that was reported by the DOH to have had Mpox. The patient is doing well now. So what you see here is like a red bump. So it's just a papule on the back. Very, not very remarkable. This is what, dito meron na siyang, you see a vesicle here on the lower part. And you see a vesicle with a like a papule of some sort. No? Medyo puti na yung nasa loob niya. And then on the hands, you have a pustule here. The fluid inside looks whitish or pus-like. No, so it can be the lesions can be as innocuous as these. No, but they're not very remarkable. And if you saw them, and you didn't, it really needs testing. Is I guess the point. So this is a summary of this patient's skin lesions. At the time he presented, in the early part, he had an early vesicle to small pustule. He also had eventually umbilicated pustules. The photo on the lower part is his perianal area. No? So dito siya actually pinakamarami, and this is the more classic picture of Mpox where you see pustules, no, and a lot of them in the perianal area. And I believe this patient also reported anal pain severe anal pain. So that's what it looks like in an actual patient. So how is Mpox transmitted? The primary mode of transmission is through close contact with someone who has Mpox. And what does close contact mean? Close contact means skin to skin, no? Such as touching or sexual intercourse. And we've seen in the 2022 outbreak that the predominant mode of transmission really was sexual contact. Mouth to skin, and face to face. When you're up close with a person, no, the talking and the breathing close to one another can generate respiratory droplets which you can inhale. But significantly absent from this slide is airborne transmission. So there have been very rare cases of airborne transmission, but in a prolonged encounter. But the main mode really is close contact. You have to be up close to a person who is sick. Remember, a person who does not have symptoms at this time is not considered to be very contagious or not contagious, no? So kailangan may symptoms yung patient, kailangan meron na siyang Mpox for you to get it from that person. Foam mite transmission is also possible. And that means, the clothing, the beddings, the towels of someone with Mpox, objects that were touched by the person with Mpox, other surfaces that have been touched by a person with Mpox, those can all be ways for one to get Mpox, no? If the objects are not sanitized. There's a higher risk for when the person who does not have Mpox but touches these objects, higher risk for that person when there are cuts or abrasions, or when that person touches his eyes or nose or mouth or other mucous membranes without first washing their hands. And then it's also possible to transmit Mpox mother to fetus or mother to child and animal to human. In fact, that's how we got it. This is essentially a zoonosis, meaning that the first one who gets sick usually are the animals, and then it's passed on to humans. Now, usually some species of monkeys and rodents. This is a material from the DOH, and this is what they are asking people to remember, no? Ano ang mga aktibidad na nagpapataas ng exposure sa sakit ng Mpox? So, pakipagsiksikan, again, the idea here is close contact. Matagalang pakikisalamuha sa iba, pakikipagtalik, pagmamasahe ng katawan, pakikipaghalikan, at pakikipagyakapan. No? So again, the idea here is close contact with someone who is symptomatic. How do we diagnose? The diagnosis is established by a combination of history. Usually we look for risk factors. The disease is not yet widespread that you stop looking for risk factors. Now, there will always be, at this point, I think, risk factors. Even if we think that there's ongoing community transmission, hindi siya parang COVID ngayon na, you stop looking for some connection, some epidemiologic risk factor. So we still need to look for a risk factor that might explain how the patient got it. Also part of the diagnosis, you need to look at the rash, visual inspection of the rash, and a thorough physical examination, especially for complications like a secondary bacterial infection. And of course, you need to test. And what by testing, we mean an MPXV PCR. Unfortunately, at this time, the PCR is only available still at RITM. And that means at the RITM is Research Institute for Tropical Medicine in Alabang. And that means that all patients who are suspected to have Mpox must present to a healthcare facility, a hospital. And the healthcare facility will receive instructions from the DOH regarding testing. We have some in place already. And essentially, right now, all testing has to be done or coursed through the CESU or the RESU. These are epidemiology bureau offices within cities and regions. No? So Sa atin, at least sa Pasig, where Medical City is, we have the Pasig CESU, and then there's the Metro Manila RESU that we need to coordinate with before the samples are allowed to be brought to our ITM for testing. That's it. Okay, so I want to spend a little bit of time talking about the outbreak, no? Why was Mpox declared as a PHEIC or public health emergency of international concern? Kasi this is also the technical term for COVID, di ba? COVID was also declared as a PHEIC. So naturally, people are now, all very, very worried about it. So the main reason for the PHEIC is the regional increase in the number of cases in the Democratic Republic of Congo and spread to nearby countries in Africa, spread to nearby countries in Central and East Africa. And then we've probably heard about the case in Sweden, and there has been one reported in Thailand. I think kagabi lang siya. No, one in Thailand. But importantly, the Sweden case and the Thai case, they are all still epidemiologically connected to Africa. No, and the current clade that's spreading in Africa now, in the DR Congo, is clade 1B. Okay, so Sweden, clade 1B. Thai, as for the last I read, is also clade 1B. So because of that, because of the increase in cases, the World Health Organization declared it a PHEIC, or a public health emergency of international concern. And by doing that, the WHO has put countries on notice of the public health risk in an effort to direct resources towards disease surveillance, mitigation efforts, and clinical preparedness. What I think we all need to realize is, by making these declarations or these classifications, may mga na-unlock na funding mechanisms yan, no? Funding for the Congo to spend on the diagnostics, for example, or the declaration will trigger some NGO to donate thousands of vaccines to that area. No? So that's the reason why the PHEIC was declared, and it was declared early. And I think this is because we've all learned our lesson from COVID. Now, I want us to spend a little more time on the details of the data, because it really shows a picture of where we are. No, so when the WHO counts the outbreak, they're really counting from January 1 of 2022. So as of from January 1 of 2022 to July of 2024, there have been 102,997 cases. So compare that to the millions and millions of cases of COVID over the span of 2 years, no? So magkaiba yung numbers. There have been 223 deaths from the start of this outbreak, and 121 countries have reported cases. Now, as of the last month of reporting, so July, 1,425 worldwide new cases and 6 deaths in July. Okay? And in July, there were 35 countries that reported cases. Hindi pa kasama ang Pilipinas dito because we reported our case in August. No? So because the discussion really is important, it centers on the African outbreak kasi doon ang galing eh. So I think we need to take a look at the African outbreak so that we have a better understanding. July of 2022 is when all this early 2022 is when all this started, but it really peaked sometime in July of 2022. So take a look at the left side of your screen. So yung outbreak in 2022 was Western Africa. No? So Nigeria yan usually, and all the neighboring countries. If you will notice, wala dyan ng Congo, no? Hindi predominant ang Congo, the DR Congo in 2022. And the clade that was spreading in 2022 was clade 2. And this is the clade that the virus that spread across the world, no? Spread to Europe, etc. And this is also the strains that we found in our 9 patients. Okay, so that outbreak, the 2022 outbreak, and you're only looking at data from Africa, no? That outbreak has somewhat gone down already. Okay, I will show you the global data later on. So the one on the right, yung mga blue bars, this is all clade 1B. Okay? So clade 1B, we said kanina that clade 1 is mostly in Central Africa, and it's endemic in the Democratic Republic of Congo, and that's where it is, no? You see the number of cases rise throughout 2023 and 2024, reaching a peak so far sometime in July, okay, of 2024. That's clade 1B. And this is the clade that produces the more severe infections, more deaths, more transmissible. So the number one country right now with clade 1B infections is the DRC. The one in Sweden and the one in Thailand is also clade 1B. As of 2024, as of August of 2024, 12 countries have reported 3,563 cases, including 26 deaths. And most of them, as we said, are in the DRC. A significant number of suspected cases that are clinically compatible with Mpox are not tested due to limited diagnostic capacity and never confirmed. Because this is happening in Africa, where in the DR Congo, where there's less testing capacity, they're losing a lot of cases. Now they're not picking up a lot of cases. So there's work in the WHO on integrating on improving the reporting. So let's take a look at the global numbers. So sabi natin there was a 2022 outbreak, no, from Western Africa, and you see here that the region with the second highest number of cases, the graph on the left, Europe. Okay, yung mga orange bars yan. Tapos you see the Philippines belongs to the Western Pacific region, yung green. You see our spike sometime in September of 2023. Okay, now the PHE, there was a first PHEIC that was declared sometime in 2022, no? So actually nag-declare na yung WHO ng emergency of international concern sometime in 2022, and inend na nila yon sometime in 2023, I believe May of 2023. So na-pick up na itong issue na to before, no? When we take a look at the data by region, the one on your right, you see that let me just move this. Okay, you see that the cases now are really mostly centered in Africa, no? And nag-iba na yung clade na ito. This is now clade 1B. Dati, clade 2. In the Western Pacific region, we said that our peak occurred sometime in September of 2023, no? And clade 2 lahat yan. And from what I know, the person who had Mpox recently diagnosed by the DOH, clade 2 siya, hindi siya clade 1B. Okay, so ano pa siya, part pa siya nung former outbreak. Okay, so we do not, as of now, we do not have cases of the clade 1B, the more severe kind. So this is a close-up view of the last several months of 2024. No, most of the cases can be explained by the rise in the African region, and this is the reason why another PHEIC was declared. It's the African outbreak that's worrisome. No, it's the regional spread in Africa of clade 1B. So yung Mpox nung pasyente natin dito sa Pilipinas, hindi siya 1B. It's still part of the old outbreak that has gone down. Okay, so the idea is community transmission, it's there, simmering, Maybe we're not picking up some cases, pero nagkaroon yung isang patient, likely because of increased awareness of an ongoing outbreak somewhere else in the world. Okay? So this is what the world looks like in terms of number of cases. Beginning January of 2022, you see the heaviest countries in blue. So the US, Brazil, no? Actually, na-surpass ng US and Brazil ang DRC and Nigeria. Heavy cases also in Europe as well. In the Philippines, we know that we have 9 cases from the 2022 outbreak. Now, case profiles for this is from the beginning of the outbreak in 2022 to July of 2024. Men who have sex with men comprised 85% of cases. However, please note the massive amounts of people with missing or unknown data, 58,000, no? So people living with HIV, about half of those with reported values. Again, a lot of other cases, 57,000 we don't know about. Okay, so it seems like there's an outbreak within MSM and HIV, etc. Pero we need to remember that the denominator is different, no? We're not accounting for a lot of the other cases. Travel history in 15%, sexual transmission in 84%, died 0.3%, no? But we do not have data for 78,000 people. Sorry, for 37,000 people. Now, when we look at the breakdown of cases by gender or by sex, predominantly men, no? Within the 30 to 39 age group, and the transmission, the mode of transmission from the beginning of the outbreak, sexual encounter, 19,000. Next lang yung person-to-person of 2,774. But again, this only accounts for 24.4% of cases. Now, again, ang worry kasi natin, yung bagong PHEIC, which is the July, no? So let's take a look at those numbers. From February to August of 2024, ito mas klaro yung data kasi konti lang yung may missing or unknown. So 95% of patients are men who have sex with men. 43% have HIV. A small percentage are healthcare workers, probably took care of those who are sick. 14% with travel history. A whopping 94% sexual transmission ang mode of acquisition. 11.4% hospitalized, and 1 death since the beginning of 2024. In February, pero there are no values yet for 583 people. Again, the distribution, more men in the 30 to 39 age group, and predominantly sexual encounter ang mode of transmission. So what I wanted to point out there is, yes, there's a new PHEIC, but the PHEIC is because of something that's going on in another part of the world. The patient that we have here in the Philippines is clade 2, part of the longer outbreak from 2022. That doesn't mean that we should not do anything about it, because we need to protect ourselves pa rin, need to have a healthy perspective, but that's where we are. In terms of treatment, what's the goal of treatment? It's to take care of the rash, make sure it doesn't get infected. We manage the pain, especially these patients present with anal pain and pain on urination, and prevent complications, no? Primarily sepsis. The treatment actually is mainly supportive. The illness is usually mild, and most of those infected will recover within a week, or within a few weeks pala, even without treatment. There is an antiviral that's been approved for smallpox, but is also being used for Mpox in a trial basis, but that is not available in the Philippines. No? So this box that you see on your right is from the WHO. So patients should be treated symptomatically with optimal supportive care to alleviate symptoms. So paracetamol for fever, oral or topical pain relievers for pain management, localized care to keep skin clean and prevent bacterial infections, adequate nutrition and hydration. So really not a lot in terms of pharmacology, no, not a lot of in terms of drugs. It's a lot of support, nutrition, etc. The new antiviral agents are still in clinical trials. What about prevention? Actually, patapos na ako. In terms of prevention, I put here two materials. The one on the left is from the WHO. The one on the right is from the DOH. So on the left, it says here, stay informed about the risk of Mpox in your community, and this is why we're having this webinar. Have open conversations with close contacts, including sexual partners, where it is safe to do so. If you are at risk, get vaccinated, but we don't have the vaccine. And the vaccine at this time is only really recommended for high-risk groups. Seek health advice and monitor closely for symptoms. Get tested if you do get a rash. No? So wag kayo please mahiya na magpakita sa doktor because there's no way to tell if that's Mpox or something else apart from getting it tested with a PCR. Refrain from close contact with individuals who have Mpox. If close contact cannot be avoided, wear a PPE. Do not share bedding, clothing, or towels with sick people. We kind of know the drill already, you know, with COVID, because we also did this to our sick relatives. Optimally they should have their own room, etc. No, wash hands frequently with soap and water or an alcohol-based hand rub. Follow the guidance of your healthcare provider or national public health authority when diagnosed with Mpox. Avoid contact with sick or dead wildlife. As far as we know, we do not have this problem in the Philippines, but it is an issue in Africa. Cook all foods containing meat parts, and then keep taking steps to protect yourself and others, even after you've been vaccinated, etc. No, so the DOH is saying, if you are going into a matao na place, no, masiksikan, like an MRT, for example, and you're really worried about this, maybe you should wear long pants and long sleeve shirts to cover your skin. It minimizes the skin to skin contact. Maybe you should wear a mask when you go to a place with a lot of people. No, remember that some people can be symptomatic. Like they already have the skin lesions, and then they can have a significant amount of cough, and you can get the infection that way if you get up close and personal with that person. No? So kami sa hospital, we still wear a mask when we see our patients. Sanitize your hands or isanitize ang kamay and iwasan ang pagkipagsiksikan. So some concluding thoughts. This is my last slide. Is Mpox really the new global emergency? Perhaps, but it is not as transmissible as the airborne virus of COVID-19. Therefore, we do not expect as many people will contract it because it's harder to pass to other people. No? And because the fatality rate is actually much lower, much less people will die from the infection. And we do not expect that it will overwhelm our healthcare system. The DOH has learned its lessons from COVID-19, and I believe that's why the PHEIC has been declared early, and now we are making preparations. Tomorrow, we are meeting in PSMID to come up with updated guidelines, which we will submit to the Department of Health. What we need at this point from everyone, especially those not doctors, we need a balanced perspective. No? You need to arm yourself with reliable information. And we've learned our lesson with COVID, no? A lot of misinformation and disinformation online. So we need to help combat those types of information. Protect yourself and those around you within reason. Avoid high-risk behaviors and environments while the outbreak is ongoing. If you do get sick, isolate yourself and see a doctor for testing. And if you're a close contact, take it upon yourself to quarantine for 21 days and inform authorities. And that's my talk. These are my reference materials. So I looked at material from the WHO, CDC, and some infographics and the data from WHO. Thank you very much for your attention.
And thank you very much, Dr. Henson, for providing us with a clear picture of the Mpox situation and some practical guidance for our community. Now we'd like to open the floor for questions. We've gathered some of the queries that our attendees have posted in our chat, and we'd like to answer some of them, no? And hopefully all. First, Dr. Karl, no? We'd like to ask, we just came out of the COVID-19 pandemic. And a lot of people are asking, how does this current Mpox situation compare to COVID-19 in terms of how fast it spreads, how transmissible it is?
Right.
Just give people, something to compare.
Okay. Well, it's really very different. COVID-19 is primarily a respiratory virus. No, it's in the airway. When you cough out, your secretions are really teeming with virus. No, it's primarily a respiratory pathogen. It's the same as the flu, and the reason why we're getting huge outbreaks or pandemics with influenza is because it can very easily be passed on to other people. No, the Mpox is very different in the sense that you really need to get up close and personal with someone. You can see how the outbreak from 2022 played out. No, the mode of transmission is really a very intimate activity. It so even if it was present in parts of Europe, for example, and in Africa, those who hindi siya as widespread, di ba? May kaso eh. So kung madaling ipasa yan, dapat mas marami yung i-expect natin na cases. Pero it really didn't turn out that way, no? As of July of 2022, we're only seeing 100,000 cases. That's a lot for sure. But compared it to the millions and millions of cases that got COVID, di ba? So really very different.
And that really puts things into perspective, especially with how you discuss how it's transmitted. And you mentioned, Dr. Carr, close contact. And a lot of people are asking, if I hug someone or if I do a handshake, or say, for example, I try on clothes in stores, should I be worried about possibly contracting Mpox with like a simple hug or a simple handshake?
That's actually an important question in terms of, how do we put this all into perspective? Remember that the number of cases in the Philippines right now, isa pa lang. Pero more likely yan, magkakaroon yan ng several other cases will pop up, no? But it's not widespread. So I think you really need to sort of think about risk, no? So if you are going to have coffee with another person and wala siyang symptoms, wala siyang ubo, wala siyang rash, baka more likely than not, wala. Baka nga mas takot pa siya sa'yo eh, di ba? So yung that kind of risk assessment, I think, is very important. Now, trying on clothes in the mall. That's a little more difficult to determine kasi especially if you don't know sino yung mga nagsuot from before, no? So maybe while we are in an outbreak, especially if we see more cases, then maybe that's something that you might want to avoid, maybe, no? Or if you're going to try it on, you wipe yourself down. The virus will be cleared or will be cleaned by regular disinfectants, soap and water, alcohol. No, it's not a very hardy virus. So I think there are ways to sort of protect ourselves with the usual tools that we have.
So really, no, it's close and prolonged contact, especially with symptomatic individuals and those with lesions.
That's really the key. The infection will pass on from someone who is symptomatic to another person who doesn't have it.
Dr. Karl, you mentioned in one of your slides that sexual contact or intimate contact is another way by which it can be transmitted. But just to clarify things, no, is Mpox a sexually transmitted disease? And to add to that, no, given the past cases that we've had in the Philippines, is it an STD that only affects LGBTQ plus individuals?
Right. That's actually a very important question in terms of placing this disease and trying to reduce stigma. No, we need to remember that Mpox is a contagious. It's an infectious disease, can be transmitted by close contact. It just so happens that in 2022, the main mode of transmission, because of certain factors, because of certain populations that got infected first, were men who have sex with men, and then because of engaging in high-risk behaviors, doon nag-focus yung outbreak, no, in 2022. But you can get Mpox some other way apart from sexual transmission. So I think that it will be a disservice to us if we label this as a sexually transmitted infection. The DOH and the WHO are making it a point to disassociate Mpox as an STD, no? Kasi otherwise, people who aren't sexually active or who are monogamous with a partner might take it for granted, di ba? When they can get it some other way. It is also not classified as a sexually transmitted infection. There are some data that seems to show that it can be found in seminal fluid, but it's a virus that can, if you're infected with a virus like that, you can probably find it everywhere in the body, all the body fluids. So the short answer for that is no, it is not considered an STD. And we really want to present a more holistic picture of transmission. And really that's making sure that we reduce the stigma that of this disease.
Thank you, Dr. Karl, for addressing that potentially stigmatizing misinformation. No? Now, some practical guidance, Dr. Karl. See, for example, I'm someone who's experiencing some symptoms that I think could be Mpox, especially if I may have been exposed or have had close contact with someone who has been recently diagnosed. What
Sorry,
do you,
yeah. Go ahead, Jello. Sorry.
what do you think would be step one for me? No, what is the first thing that I should do,
If
or
you were exposed, is what you're asking, no?
or if I think I have some symptoms? No, like say, given the rash or the skin
Okay.
lesions that
If you have symptoms, so if you think that you might have symptoms, then you see a doctor. In the meetings with the DOH, which happened I think yesterday, I wasn't there, but I was told that the Philippine Dermatologic Society, they're very much willing to take a lead on this, no? Take the lead in making sure that patients are diagnosed appropriately, etc. So go see a doctor, go see a dermatologist, go to your ER if you're quite sick, no, my fever and you feel very sick, then go to the emergency room. There are protocols in place already. We've dealt with Mpox in 2022. We do have some protocols that the doctors already know. So get yourself checked and tested is the first step, kasi it really needs to undergo testing.
And I guess from there, the doctor will really facilitate the necessary referrals to our epidemiology and surveillance units.
Right.
And
So, ibig sabihin, kasi this is a lay forum. So, basta ang importante, they go see a doctor, better a hospital, kasi mas plugged in ang hospital to the CESU and the RESU. No? Bahala na yung hospital mag-facilitate ng testing.
Dr. Karl, so say for example, someone has already been diagnosed with Mpox, and confirmed with Mpox. Are we allowed to care for them at home? And if
Yeah.
yes, how should we care for them? Is it the same as caring for when we had COVID-19? Some patients, milder cases, were allowed home isolation and home care. What should be done? Separate rooms, disinfection practices. What can you advise for home care, for diagnosed Mpox patients?
So the pictures that I showed you, that patient of Dr. Buencelito was actually just isolated at home. He was admitted for several days and then he went home, recuperated at home. So again, very doable because they're after the initial prodrome of fever, they're not very sick anymore. They really just need to deal with the skin lesions. So yes, people can recuperate at home, ideally with their own room, especially if they keep on coughing. People at home can care for them. They need to wear appropriate uh, personal protective equipment, primarily gloves and mask, and maybe some eye protection if the patient is coughing a lot. Tapos, syempre, minimize contact with surrounding, hand washing, etc. In the hospital setting, since we're dealing with sicker patients, may ubo yan, etc., the healthcare workers are being asked to wear an N95 mask, a gown, eye protection or face shield, no, and then gloves. It doesn't have to be sterile gloves. It can just be normal, clean gloves. Healthcare workers by now should know doffing and donning procedures, etc. So, yeah.
Thank you, Dr. Carl. Just a few more questions. No, one, you mentioned that it can be deadly, especially for particular strains. But the skin lesions, no, one question is, are the skin lesions disfiguring? So, like after you've recovered, are you expecting like some heavy scarring? Uh,
If I'm not 200% on, I'm not 100% on my answer, but from what I know, it behaves like chickenpox in the sense that if you do not pick on it, it won't leave a scar. No, the epithelium will form. There's going to be skin that forms under the scab, and supposedly mawawala siya, no? So if you do get Mpox, don't pick on the scab, on the lesions. Just let it be. Apply some soothing lotion or whatnot, maybe a topical antibiotic if it looks infected. But don't lift the scab, don't pick on it para hindi siya mag-scar.
Okay, thank you very much, Dr. Carl. And I think we also have with us, no, some healthcare professionals, including those working in hospitals. And this is the last question. No. For our healthcare professionals, are there any guidelines, no, that they can follow when it comes to referring individuals for further testing and contact tracing?
The guidelines for healthcare workers are actually still being refined. But what is in place right now is that patients who present to the ER suspected of having Mpox are kept in they're placed in an isolation room or away from other patients, and then the CESU, the Epidemiology Bureau CESU, is contacted. The sample is collected, and then the sample gets brought to RITM for testing. There is what what we in PISMID are trying to do is to try and get other hospitals apart from RITM, uh, allow them to perform the PCRs, no? Kasi if dumami man yung kaso, then we don't need to send our samples to RITM. Medical City has a very capable laboratory. I'm sure all the other tertiary hospitals have put up their own PCR testing because of COVID, no? A lot of the labs were capacitated because of COVID. So I think we have a lot of testing capacity, but we just need to be allowed by government to do the tests. But for now, all testing is under RITM.
Thank you very much, Dr. Carl. And that's all the time that we have for Q&A. We've taken note of all of the questions posted in our chat, and we've compiled them, and we will try to provide further information to answer these questions, as course through ASMPH and through the University Health Service. And with that, we'd like to now close this very informative webinar. Thank you very much, Dr. Karl, for your time and for your expertise. And to officially close our program, we now invite Dr. Shaw Marquez, Assistant Vice President for Healthcare and Wellbeing of the Ateneo de Manila University, for his closing remarks. Dr. Shaw?
Thank you, Jello. Again, would like to express our appreciation to Dr. Karl Henson for that very informative discussion. It again helps us in terms of not just allaying our fear, but also in having more rational interventions in place, no? Especially with the limited resources that we have in the university. But at the same time, I think what's important is what Dr. Henson emphasized as that balance between vigilance and I suppose prudence at the same time. Okay? So still we're recovering from the COVID-19 pandemic, and yet we face already another public health emergency that will have definitely a global that will have global consequences, regardless of how many countries or continents that Mpox will reach. We hope to have learned that a strong foundation in primary care and a robust, responsive, efficient, and equitable health system serve as critical elements to our capacity to endure the impact of any pandemic or any health injury for that matter, whether it be personal, physical, psychological, social. Okay. It's important, therefore, to realize that the university is committed to actively participate in nation building through capacity building efforts to improve health outcomes. Internally, we have been integrating our health services to promote health and well-being through synergized medical, mental, and spiritual interventions. Again, in behalf of the university, we thank everyone for joining us today. We thank, of course, the organizers. Taking lead, of course, is the Ateneo School of Medicine and Public Health, in cooperation with the Office of the Vice President for Higher Education, Office of the Vice President for Mission Integration, and of course, the technical support from our university marketing and communication office. Again, thank you, everyone. Have a safe but enjoyable extended weekend. And so, thank you and enjoy your day.
Thank you very much, Dr. Shaw. And thank you, everyone, for your participation today. We've gained crucial knowledge about Mpox, its impact, and our role in prevention. Remember, informed action is our strongest defense. Let's move forward with vigilance and not fear. Share what you've learned, support one another, and stay updated with reliable information. Together, we can protect our community's health. Stay safe, everyone, and have a great day.